So let's talk a little bit about your own experience in disease control and management before we talk about the optimistic, the good news, which is vaccines. You were involved on the front line in the campaign to control Ebola disease in Africa. What lessons did you learn from that experience?
The first lesson, I would say, is, it's not that these events are completely unanticipated. I mean, there are a number of infectious diseases around the world that have potentially the same potentials that Ebola has. And we have the opportunity to prepare for them. And in fact, that was one of the reasons that my organization, CEPI, was set up after the West African epidemic, is that it was realized that we could have prevented the entire West African epidemic if we had invested more in developing vaccines that were already actually under development at the time. That's one lesson. Another lesson, I think, and another very important lesson about epidemic diseases, even epidemic diseases that don't have pandemic potential, is that the costs that they impose when epidemics occur, even if those epidemics are occurring in very poor and for many people remote, countries in Africa or wherever, the costs are gigantic. The epidemic in West Africa principally affected just the three countries. There were a few cases that spread outside the countries, obviously, but principally affected just the three countries, very poor countries in West Africa, ultimately leading to 28,000 cases, 11,000 deaths, and an estimated global economic impact of $53 billion, which is close to $2 million per case in West Africa. And that's extraordinary for disease in poor, remote countries. If you look at what we're experiencing now with COVID-19, the IMF has estimated that COVID-19, because it's a global pandemic and it has devastated global economies, may result in an economic impact of as much as $12 trillion over 2020 and 2021. That's extraordinary. Right now, there have been just over 30 million cases, and if you look at just the cost for 2020, let's say it's $6 trillion, that's still at the rate of $200,000 per case that's been documented, which is extraordinary.